we wanted to illustrate for you guys the application of a Pavlik harness so that one, we can help hopefully dispel some myths about treatment of developmental dysplasia of the hip, and could also show you a little bit how we treat it. So in patients where we do have a diagnosis of developmental dysplasia of the hip, in some milder cases, we'll actually just observe with ultrasounds to make sure that the hips continue to improve. In hips where there's either more pronounced dysplasia or the patient started to get a little bit older and still has a shallow socket, our first line treatment from cases of milder dysplasia all the way up to even the most severe dislocated hips is the use of the Pavlik harness. And so Kristen has applied the Pavlik harness to Maya, and the way that this treatment works is by holding the hips generally in a flexed and separated or abducted position, as Kristen's demonstrating. What this does is it puts the ball deeply against the socket and encourages the ball to make the socket deeper with time. And this is nothing forceful, it's very gradual. And in contrast to some of the older treatments prior to the Pavlik harness, this was revolutionary because it was a dynamic brace that allowed the hips to still flex and move within a range of motion. It's just that that zone of motion is in a generally flexed and abducted position. We also wanted to take this opportunity to go over a couple of the common myths. So Kristen, what are some of the most common myths that you get from new parents?
Yeah, so when the parents come in, they are concerned about the comfort of their baby. They're concerned that when they're in this harness that it's going to be uncomfortable. So we just reassure them that this is not a painful treatment, that if anything it's just a little bit restrictive for them and they get used to it very quickly and do very well. Another common myth is that bringing them in with hip dysplasia, that they do have to go straight to the operating room to have surgery to fix this. And we just educate them that once their baby is in a harness, that they usually do very well with this. It's very successful and usually keeps them from having an operative procedure.